black foam looks like. See here, how black foam looks like. See how polyvinyl alcohol white foam looks like. So depending on the situation, we'll do the. Depending on the situation, we'll select the different types of foams, whether we will use black or white. But commonly, most of us use black one because it's added effect and it creates the aggressive granulation tissue formation as such. So this is the one which I have already told how exactly it acts. So here you have to put foam. This is the ulcer bed. This is the foam you have kept there, and this is the sterile adhesive film. See that this gap is important. It should cover beyond 3 to 5 centimeter, and it should be airtight and watertight. It should go beyond. If ulcer is like this, foam is within that, and sterile foam, and it should go adhesive film should go 3 to 5 centimeter beyond the ulcer. Then only it will be effective. Otherwise, if it is not airtight, then your entire exercise is becomes waste. So that's very important. Then make a cut here in the center or wherever convenient for you, so that and one more adhesive round fixer is there. That you fix over that. That tube again connect to the vacuum with the canister there. So create the negative pressure. Switch on that, and it creates the negative pressure and start functioning as such. This diagram is very crucial to understand how negative pressure wound therapy works or helps. So this is the actual how it looks like. This suction tubing with the pores. These are called as pores. These are called as pores actually. This is a suction tube. This is the canister here. Collection canister. See that VAC pump here. This is the semi-permeable drapes. Iodine drape sheets, adhesive films we were using it earlier in a crude method before availability of all these company manufactured specific products as such. So, but this is actually everything with suction apparatus, everything is there. So this is good actually. Semi-permeable drapes, they are transparent and visible what is happening inside. I'll show the photos, you will come to know. So these things are essential to do. This is the black foam. See that black foam? You can see that black foam. Then pores, suction tube, canister, vac pump, and semi-permeable drape for adhesive drapes. Adhesive drapes. You can strip and put it. And this is the requirement. It just gives everything what I required. And this is the machine. Once you connect there, what type of checklist, everything, mode, what mode you can use, intermittent. Usually we use a continuous mode. This one. This is the canister you can see here in the diagram. So this is connected to the wound actually through the port as such. And this is the manufacturer thing, how it sterile one it comes, vacuum granulation to this. So you can see that this system, vacuum system in VAC system comes. This is the you cut open foam there. Within that, the tubes are there, connecting tubes are there, and this is the opened one. And then you cut whatever the size. You can see the tape is there, measuring scale is there, and measure the ulcer size, dimension. Then cut to whatever way required because it should go within the wound. That's important. And you have to press properly and keep it. After cleaning with the sterile normal saline, then put a adhesive film. See that? This is the adhesive film we are placing. So this is everything everywhere. See that how beyond we have put actually. See that? See the foam here? See the foam here? This is the adhesive film. This is the foam. So this is the port actually. We made an opening here. This port has come. This is the connecting tube actually here. And that goes to the suction pump and the canister actually. So you can see this this patient. You can see how bad wound is there, and wound debridement is done, and after that it is connected. This over that wound dressing you have to put actually. Then it's connected like that. This is the canister. How it looks like that. Measuring. You can measure how much fluid has come. Everything. How much fluid. This is the suction one. So suction shows the whether green. It may send alarm also. So some sound it gives, so that is normal. Alarm means there is some problem. Probably negative pressure is not adequate. Somewhere it has got torn or it's not sucking. Tube may get blocked. So for all these things, alarm comes. That means you have to whoever attending caretaker of the tube or whoever it is, nurse, hospital nurse, or if patient is at home, you have to call somebody who is doing that. Technical people are there. You call them and ask them to see what exactly tube may be blocked or what exactly. So rectify these things. So alarm is there. That also the patient should be trained for that. Should be informed clearly how exactly it functions. So this is how exactly this port is there. Comes like this. This is the canister here. The diagrammatic. This is actual. This is actual. This is the diagrammatic one. So now pressure. I said minus 120 to 125 in adult. But in neonates, that much pressure is very high, can't use that. It is minus 50. Children less than 2 years, minus 50 to 75. And children more than 2 years, and minus 75 to 125. Adult minus 125. Doesn't require much more than that. So these are the different pressures in different age group. This is very important when you use, especially in pediatric age group. If they use, they should know. They should not go standard pressure like what we use for the adult. So this is how exactly it looks like. This is the negative pressure wound therapy system. This is the port, this is the tube, canister is there here behind. So this is how exactly system looks like. Now, what is the facts in the negative pressure wound therapy? How it works, how patient is benefited, how surgeons are happy with this negative pressure wound therapy. It is used for chronic wound ulcers, will heal in 3 to 4 weeks. Once it heals, granulates well, you can put a graft, a flap, or coverage, wound coverage you can do very well. And needs, but change of vac once in 3 to 4 days, that's important. Change the dressing, not the vacuum power system. The tube and foam has to be changed usually once in 4 days. You have to change it, and you have to see the canister, how much it colors. Observation of the content in the canister is important. So what color it is, whether serous, purulent, sanguineous blood, or serosanguineous. So you have to observe that and keep an watch on that. How much it comes also, quantity, measuring gauge is there. That also should be checked. Continuous negative pressure is better. You got continuous, you got intermittent. One more, you got cyclical, where it is not continuous, it is not intermittent, sorry. And it is continuous, but high, little bit low, high, little bit low, but not zero. Whereas in intermittent, it is minus 125, 0. Minus 125, 0 like that. Whereas in continuous, persistently minus 125 or 125, whatever gauge you are set actually, pressure gauge you are set. Whereas in cyclical, minus 125 comes little, maybe minus 100 or minus 75 it comes, again minus 125. So it is cyclical, it doesn't come to 0 actually. So many instruments available from the different companies are set for such a type, even though they say continuous, it is not continuous, it is rather cyclical actually. We can use in the different types actually. So however, 2 hours pressure off in 24 hours can be done. So when we will do pressure off for 24 hours, that's important. Then while removing the dressing, power should be off and negative pressure should be removed. It's very important. Power should be off. Without power should be off, without negative pressure off, you remove the dressing is not good. It may traumatize the skin around, or it may traumatize the granulation tissue, may cause bleeding also. So putting off the power and removing the negative pressure, making it 0 is very crucial. That point is very important when you are changing the dressing or changing the vac, putting the new one. Pink healthy granulation tissue is a sign of successful remission. Look at the wound, you will be able to see. It rapidly, granulation tissue comes, you can compare earlier, you can take a photo and keep, and eventually every further dressing you can take further photos. Then you know how exactly it is. Negative granulation tissue are formed and eventually they are ready for the grafting. So this is how exactly, it's a clinical sign. Once you see, you will be able to make it. So what is the mechanism? Macro deformation of the tissue. That means wound starts healing from the side. New tissues also develop, and so wound size will come out, get reduced. So that is called a macro deformation. That is also important. Mechanical stress in the tissues which promotes the expression of vascular endothelial growth factor and fibroblast growth factor 2, which stimulates, this is important, angiogenesis and granulation tissue formation. So stimulation of angiogenesis, formation of granulation tissue formation, becoming healthy wound, that is what you are intended to. And drainage of extracellular inflammatory fluids, exudates are removed. stabilization of the environment of the wound. Wound environment is stabilized. So stable wound with healthy granulation tissue, with the least discharge, without any infective focus. So reduce the bacterial load also. Control the bacteria, prevents the further infection, contamination.